All right. So I just wanted to start out by saying that telehealth is kind of a new thing for public health nursing in Wyoming. It's not something that we've really utilized a whole lot of other than administratively, for things like case reviews and meetings and things like that, and have not had really an ideal platform for that takes into account the HIPAA secure, HIPAA compliance and things like that. And so we are really excited to have this opportunity. So just a few reasons why public health nursing is looking at using telehealth, and hopefully we're going to have opportunities to connect with those of you out there who might have ways to connect with us to serve our clients. As many of you probably know, Wyoming Department of Health is centralized. So all of our administrative work for the Department of Health is out of Cheyenne, and then our staff that really do all the boots on the ground work with clients are scattered throughout all of the counties. There are a few states out there who do kind of a similar format, but it is a little bit different and a little bit challenging for us in terms of just having everybody spread out. So really telehealth is an opportunity to pull us back together without having to have us all in one place. Telehealth is actually used, as you probably know, in a variety of settings: primary care settings, medical specialty settings. We know that it's used in public health also, but surprisingly, it's not very well documented. If you go out there and do a literature review, trying to look for best practices for public health nursing specifically, in telehealth, there's just not tons out there. And so it's definitely one of those fields that's kind of new, I think, across the board, or at least not something that is well talked about. So my hope would be that Wyoming could maybe set an example as we get good at this, that we could perhaps, put that information out there for other states and other entities to kind of see how things have gone well and maybe what things maybe haven't worked well, and get some of that documentation out there, because otherwise we don't know. It's hard to develop best practices when people aren't talking about what they're doing. So public health nursing serves the populations that we want to reach. So, a lot of our populations are very isolated. They're out in rural and frontier areas. It can be very difficult for them to access different types of healthcare services. And so because we have public health nursing offices in each of those counties, and we go out and we do a lot of different outreach services, we're in homes doing home visitation. We partner with a lot of different entities within our communities. It's just it really is a great place to kind of be a host or a hub for telehealth type activities that can hopefully connect people to services that are out there at a distance. And of course, as all of you know, and I've been enjoying this morning, geography is definitely an issue when it comes to serving those populations and hopefully getting them served. Just so you're aware, I've been in the car most of the morning, and I'm actually presenting to you today out of the Rollins Public Health Nursing Office on my way to Afton. So I'm actually not in my office. So it's fabulous. And this just kind of highlights how great it is that we can just take Zoom with us and really do what we need to do from wherever we happen to be. So right now, all of the county public health nursing offices are equipped with Zoom licenses, and those licenses are supposed to be able to accommodate up to 50 people. So that's great news from an administrative standpoint. It's also great from the standpoint that at least in other prevention services, telehealth has been used to deliver classes to populations, and actually has had pretty good results with people attending that way, just because people are able to call in from their own homes. They don't have to necessarily find childcare. They don't have to drive somewhere that might be far. It's a great setup for delivering that kind of a service. So having a big license is fantastic. And everybody should at this point also have the necessary hardware. So we did have a few offices that we needed to equip with cameras and microphones, and I believe all of those have been set out. So from a setup standpoint, we're pretty much ready to start using telehealth in our offices. We are already using them administratively. We've been using Zoom quite a bit for different administrative uses, but we are hoping in the next couple of months that we can start piloting host sites. So we can start actually using our public health nursing offices as host sites. Guidelines and orders for that are underway. So our offices will basically have everything that they need to make that happen. And then what we really need is people who are willing to connect to see patients. So a couple of the counties that have actively voiced interest have been Albany County and Bighorn County to get this going. And so we're very excited and hope that we're able to, start seeing patients really through our host site soon. So just to kind of go over basically how we've been using it so far, and then what our potential uses are that we've really talked about and are planning for. Administratively, like I said, we've been using that. We are able to use it to train our nurses. We can also use it to basically do like hands-on. We can watch nurses do hands-on activities and check them off that that they're competent in doing what they need to do with that. So that's kind of a really cool thing, especially when it might be difficult to get our trainers out to each site to do that. We've already seen improvements in communication and connections because we do have that wonderful ability to have a face-to-face connection. We're also using it for mentorships. So our home visitation programs are able to meet with the MCH coordinator who basically trains all of our new nurses. She's able to have these face-to-face mentorships, which really does facilitate better communication between the mentor and the mentee. So that's fantastic. Really, really has been very useful for that. And also because telehealth is secure, HIPAA secure, and then, in terms of making it compliant, we just need to make sure that we're in a private place with the door shut and things like that. We are also able to do case reviews, which is very, very helpful for those newer MCH nurses to be able to kind of go through different cases. So that has been fantastic. Really, really useful in those ways. So of course that's great, but the bottom line is that we really want to be able to impact our clients and be able to help them access healthcare. So the ones that specifically have been talked about so far for operating basically as host sites, we've talked about being the host site for our genetics clinic through our Children's Special Health program. We have been having genetics clinics, for years in Wyoming, but because we are in a resource-constrained environment right now and our budget keeps shrinking, we have to find new ways to serve those clients that need those services. And so it gets really expensive to fly our genetics provider in from Utah. So this is, we're already working with MCH to hopefully, in the very near future, pilot using the host sites for the genetics clinic delivery. And it won't completely get rid of the providers' need to come to Cheyenne or come to Wyoming from time to time, but we estimate we should be able to actually cut that travel in half. And so that's going to save quite a bit of resources to be able to do that. We've talked also about behavioral health and basically, being a host site for those clients that need more intense behavioral health services than we're able to necessarily provide in a community. I know providers can be pretty sparse in the more rural areas, and so we definitely want to be able to connect to behavioral health specialists and make sure that those services are more and more available to our communities. And then because we do work so closely with MCH and the Children with Special Health programs, the pediatric specialists, you know, if you have respiratory specialists or cardiac specialists or, you know, those sorts of things that your kiddos are needing to have follow-up visits, this is a fantastic way to facilitate that so that they're not having to drive to see a pediatric specialist every couple months. You know, they might have to go once or twice a year to do labs or do imaging studies or whatever the case may be. But for those follow-up visits where they're just kind of checking in to see how things are going, we envision that this is going to be a fantastic platform to be able to provide that. Within public health nursing, we also will be able to use Zoom as basically something to facilitate home visitation when we have things that get in the way. We still want our nurses out in the homes because it's invaluable. You catch so many things that you wouldn't otherwise by actually visiting them in their environment. And so we definitely want that, but there are times that, you know, you're due for a visit and you just can't get there because the weather's bad or there's been weather recently and the terrain is bad, you know, that sort of thing. And so this would facilitate being able to, you know, have you can basically send your Zoom link to your client. Your client can click on that and then hopefully access their nurse that way. This is also going to be a great tool for, you know, breastfeeding support and other questions that happen to come up for a client where maybe you don't need to drive an hour out to their home necessarily to do a visit, but to check in and maybe see what's going on with the client, you can still do it this way. So that's fantastic. And actually NFP has recently, that's the Nurse Family Partnership. It's one of the home visitation models that we use here in Wyoming. And it's actually a national model based on evidence-based practices. It's fantastic. They actually do allow for telehealth visits now. And so I think that in general, public health nursing is moving that way, not solely, of course, because we like to be in the home for different reasons, but it's definitely a fantastic tool to facilitate connections. And especially since, you know, a lot of our younger clients especially really do seem to communicate well or better even in some cases through technology. And so this is just a really great way to, I guess, meet them where they are essentially. One of the other issues that we run into is that, of course, some of our counties are very, very small in terms of the staffing that we have available to us. A lot of our nurses are kind of going in 50 different directions at once. They may be doing home visits, you know, and then an hour later they're doing immunizations, and then maybe they have an LT 101 that they have to go do. They really, really have a lot on their plate and a lot to do. And they're being asked more and more to do that with fewer resources. So unfortunately, the time and the staffing that it can take to maintain some of those services can be challenging. And so we will be using telehealth to hopefully augment, you know, some of our nursing staffing issues, you know, to maybe facilitate them being able to do those visits a little bit easier and see clients a little bit easier with, you know, saving that hour drive time one way and things like that. So it's very exciting. And I'll be honest, there isn't tons of research for public health specifically out there on that. There's a little bit, but not much. So I'm really excited to see what we're able to do with that. There is research out there, however, on whether or not telehealth is an effective model to really address chronic health issues. And of course, that's more and more something that public health is talking about and really needing to address. It's also an area in public health nursing in Wyoming that we tend to be a little weak on. We have 8 essential services that we have to provide in each of the counties. But chronic disease management is not always something that we are real strong with, simply because we just don't necessarily have the resources to address it. And so telehealth is giving us a way to hold classes, you know, and even facilitate, we're not doing this currently, but we could in the future facilitate one-on-one prevention activities. So if you have in your adult wellness programs, you have, you know, a client who's signed up to do wellness activities to improve their blood pressure, you could sure have, you know, the person that they're working with to do that. You could check in with them face to face once a week or once every couple weeks or whatever the case may be, to help really foster that attention to you know, whatever their chronic diseases that they're managing. And like I said, in the literature, the classes are actually really well supported. They've had really good outcomes in terms of people attending and paying attention and asking questions. And I, having worked with, you know, some more behavioral type issues and delivery of classes to address them and things like that, focus groups, it can be really hard sometimes to get people to attend and to participate in those types of classes. And part of it is that they have to be in a room with a bunch of people that they may not necessarily know, and then they're being asked to talk about health behaviors that maybe they're embarrassed about or that they're not very comfortable talking about in person. And the telehealth platform really kind of gives that sense of separation. So you're essentially still in the room with them, just from your own environment. And so I think that really is helpful for helping people be more open to actually doing the types of activities that they need to and having the kinds of conversations that they need to in order to actually make those behavior changes. So that, I think that's really, really exciting. And again, that's one of those areas that public health nursing is able to use this for, and hopefully have some success there. Communicable disease control is another area that we haven't had the opportunity to use it that way just yet, but the hope is that you know, as we have more challenging tuberculosis patients and things like that, we'll be able to use the telehealth platform to serve our clients that way. So for instance, you may have a client who is on direct observation therapy for tuberculosis, whether that be a latent case or an active case. And, you know, their DOT may fall, they may be due to have an observed therapy on a Saturday, or like happened this past Christmas, I actually had one who was scheduled to have one of her observations on, I think it was Christmas Eve. And so in that case, my nurse was willing, because she didn't have anything else going on, she was willing to drive out and do that, which was great. But this type of a platform allows our nurses to actually do those activities without having to actually come in, you know, and go actually drive out to a patient to their home to watch that, or have them come in if they are doing that in a tuberculosis clinic type of a setting, which I'm not sure any of our clinics actually do that here in Wyoming, but across the nation, they certainly, you know, can have like a certain time that clients will come in to do their DOT. So this gets around some of those weird scheduling issues and timing issues and a distance issue. You know, and it does allow a little bit more freedom for your client, because, you know, maybe they're traveling and they still, you know, they may need to travel for their job or whatever the case may be. This gives them the ability to still essentially keep that appointment for their direct observation therapy. So that's really exciting. And actually when Charla came to me about telehealth and kind of started introducing me to the Zoom platform, that was my very first thought was, oh my gosh, how great would this be to be able to utilize it for our tuberculosis patients. And that is something that the chronic disease unit, I've talked it over with them a couple times, and they're pretty excited about that too. So luckily we haven't had an opportunity to have to use it that way yet, but I'm looking forward to being able to in the future. And then, you know, we have other communicable diseases that that take some time to manage. And so You have the opportunity like for HIV management or perinatal hepatitis B. There are some opportunities there that can really facilitate public health nursing's ability to take care of those patients in a more expedient and efficient way, I think, which will be really great given the fact that our resources really are, kind of limited right now. So fantastic platform. So the next steps that public health nursing has to do to be fully operational, I've actually been doing a literature review for several months, and it's been kind of slow going just because there isn't tons out there. So there's a lot of translating what things have happened in specialty practice and other offices, and kind of translating that to nursing, essentially, and how that really looks best in our public health nursing offices. The development of the guidelines and orders for telehealth activities is already underway, and basically it's a template, and then our counties are able to, there's just a little bit of wiggle room in there because everybody's practices are just a little bit different. So, local policy will probably be a little different from place to place, but this will give us standardized, basically across the board, this is how we're going to do telehealth in our offices. And then of course we're piloting client-based clinics and encounters. So starting out especially with that genetics clinic and being able to do that. We really, really need to work to build relationships with other Wyoming telehealth providers. So that's where a lot of you come in, hopefully, because we don't have a lot of those connections yet. So I'm really glad that I was able to come in and talk to you today, and hopefully get my name out there so that we can start having those conversations about serving your clients that happen to be out in our communities. Very recently, we have also started looking at options to boost our telecommunications capability in our rural counties. So case in point, I'm here in Rawlins, and here in the public health nursing building, their internet service is kind of off and on. It's not always, it isn't always real stable. And I know that that's the case in several counties, not here in Carbon County. There's actually a number of companies out there that will help you draw down subsidies from the FCC to boost connectivity in rural areas. And so we are looking at seeing if we can be part of a Wyoming consortium to basically be able to draw down the subsidies and the funding that we need to boost our broadband and things like that in these areas that just don't have great communication or don't have great telecommunication capabilities right now. And that's actually been, we're working on implementing an electronic health record across public health nursing in Wyoming. And that's been like one of the very biggest questions out there is, well, great, but how are we going to use it when our internet doesn't always work for us? And so this being able to, really facilitate better telecommunications across the board will definitely be an important step to ensuring that we can not just start to do telehealth type activities, but also maintain those over the long run. So that's where we are, and really April is when we're going to really start having the most serious conversations about making those connections with providers in Wyoming and outside Wyoming to start providing services for our communities through telehealth in our public health nursing offices. So if you are someone who is interested in partnering with us, please let me know. My contact information will be at the end of this particular presentation, and Corey, our host, also has all of my contact information, and he's welcome to share that with whomever asks for it. And then I can, of course, as we have clients in different communities who need to maybe use that service, we can work to ensure that we have your connection with that local public health office. Also, since there just isn't much out there in the formal literature, if any of you have sample guidelines, orders, or clinic procedures that you have used or seen in your use as a host site, if any of you have served as host sites for telehealth, and wouldn't mind sharing them just for comparison's sakes, so that I can ensure that what we're doing is on track with what most people are doing, I would be really happy to look at those. If you don't, that's okay. We're still moving forward with that, but it's always nice to kind of see what other people are doing, so you can hopefully marry things up and ensure that you're all on the same track. So this is actually my first full meeting going to the Wyoming Telehealth Network. So I'm really glad that I was able to join the meeting today and have a chunk of time to present to all of you, but I plan to be here more frequently. So hopefully I'll get to know a few of you better through the telehealth network. And like I said, if any of you are interested in partnering, please let me know so that I can connect you with the appropriate public health nursing local office. Corey will also be in the near future, we'll be putting out the public health nursing office sites so that you're able to see essentially who the local contacts are for that.